Debate. The member from Whitby, Oshawa.
Yes, will be good.
Thank you, Speaker. I'm pleased to stand and speak to Bill 41, the Patients First Act. And my views on this bill, Speaker, are based on my experience as the past president of the Ontario Association of Local Public Health Agencies, the chair of the Region of Durham's Health and Social Services Committee for 7 years, and as a senior civil servant with the Ministry of Health and Long-Term Care. Last week, Speaker, my colleague, the member from Elgin, Middlesex, London, and the Ontario Progressive Conservative health critic provided an excellent overview on the state of Ontario's healthcare system and a specific critique of the proposed legislation, the largest proposed health system restructuring that we've seen in close to 15 years. Speaker, let's turn for a moment to the local health integration networks and the greater accountability that's laid out in the proposed legislation. I don't believe that the local health integration networks leaders have the manpower nor the experience to oversee such a massive transformation in how health providers work together. They don't have the governance structures in place to take on hospitals, home care, community care, and in their spare time, linked with public health. While the LHINs have added staff with the Community Care Access Centre managers folded into them, these Community Care Access Centre staff have experience contracting home care services, not overseeing, Speaker, an entire health system's operations. In fact, taking on the role of the Community Care Access Centres will overrun the LHINs in the short term, leaving no time, Speaker, for integrating home care within the larger system. There are approximately 5,000 people who work for the Community Care Access Centres provincially and around 500 working for the LHINs. The LHINs are going to have to figure out what the CCACs do and how to integrate them. And it is, as it is, the task of managing a diverse range of nonprofit and corporate agencies that provide home care has proven notoriously difficult for the CCACs, Speaker. Now, meanwhile, the LHINs don't have a proven track record, do they, Speaker? A 2015 report by the Ontario Auditor General criticized the LHINs for several shortcomings, including that many LHINs haven't met wait time targets and didn't successfully plan to meet the needs in areas like palliative care and certain hospital procedures like hip and knee replacements where performance has declined since 2010. Speaker, what's clear is that the LHINs have not been operating with the efficiency that most of the residents here in Ontario hoped they would. But the Ministry of Health, through the proposed legislation before us, has continued down the path of giving the LHINs even more authority.
Wow.
Speaker, under the Act, only family health teams, community health centres, and Aboriginal health access centres will fall under the LHIN's authority. For months, Ontario doctors have been calling on the government to make substantive changes to its primary care legislation. And they believe that prorogation gave the government the opportunity for meaningful consultation with doctors who work on the front line. But, Speaker, despite that, the government has chosen to reintroduce this legislation without such consultation and absent the amendments thought by the medical profession. The government says it's committed to healthcare transformation that will make the Ontario health system stronger and serve patients better. But what's clear, Speaker, what's clear is that the government ignores evidence from around the world that physician collaboration is critical, absolutely critical, for the success of such sweeping transformation of Ontario's healthcare system. When it comes to the LHIN's role in integrating care, another key aspect is that the legislation mandates, Speaker, the creation of sub-LHIN structures to oversee integration at a more local level. Within this concept, I'm concerned that the measures will create yet another reporting system, more red tape that doesn't improve the care for the very patients that they purport to be concerned about. Speaker, creating a sub-LHIN structure with all kinds of accountability and reporting and government requirements will lead to a duplication, in my view, of an existing bureaucracy. So, Speaker, if patients are truly to be first, then patient advocacy should be at the very top of the list of concerns. Speaker, but it's not. The newly empowered LHINs have no clear role to act as client advocates, and it should be a reasonable assumption, Speaker, that any commitment to patient needs should include a clear role for advocacy. Speaker, I would point out, too, that the LHINs will now be singularly responsible for allocating funds to public health units and creating accountability agreements. From my experience at the region as the Chair of Health and Social Services, being beholden to the LHINs for the funding will undermine the ability of the Chief Medical Officers of Health to provide the LHINs with the independent advice and information they require regarding local health system planning and performance. Speaker, finally, I would like to share some narrative on Bill 41 given by one of the largest healthcare groups in my riding, the Oshawa Clinic Group, Canada's oldest and largest multi-specialty medical group practice, and they're located in Oshawa. It was founded in 1927 and now has 130 physicians and surgeons practicing from 4 outpatient facilities in the region of Durham. On October the 5th, the clinic sent a letter to the Minister of Health, which stated in part, our review of Bill 210, now Bill 41, combined with a review that has been circulated by both the Ontario Medical Association Speaker and the LHINs, are extremely alarming and totally contradictory to the philosophy of our group. In our opinion, this legislation will be very detrimental to our healthcare system and will severely compromise our ability to provide quality care to our patients. This letter emphasizes, Speaker, that the proposed legislation represents the micromanagement of our healthcare system and the fact that the growing bureaucracy has had a direct impact not only on operations but also on frontline patient care throughout the province. And Speaker, the letter went on to give examples. Underfunding of diagnostic services resulting in significant losses for diagnostic imaging facilities and restrictions on the ability to add new family physicians to existing family practice modes, resulting in well-trained doctors leaving our province.
Sad, very sad.
The letter concluded by saying that the Oshawa Clinic will not be engaging with the Central East LHIN as proposed by the bill, since it would only contribute to additional waste and a further reduction in frontline patient care. Speaker, with Bill 41, there appears to be limitless faith in administrators with no direct experience in patient care to be able to reinvent a healthcare system without the means and practical abilities to do so. In short, the Patients First legislation will mean that LHINs have their work cut out for them. The most challenging part for the LHINs will be convincing primary care, public health, and hospital leaders to be cooperative. Speaker, I'm pleased to have had the opportunity to share my concerns about the proposed legislation, and in particular, the primary care delivery model that's outlined in the legislation. The legislation has flaws, and that is why I won't be supporting it. Simply put, it's not putting patients first, Speaker. Thank you very much.